Hello, we are discussing 5 PYQs of PSC for assistant surgeon. The first question is based on the syndromic management of STI by NACO, color coded kit and targeted syndrome are given. Find the correct match. First is white vaginal discharge. This option is wrong as we know that white is used for genital ulcers. For vaginal discharge we are using green colored kit. Green urethral discharge. It is wrong. For green kit we are using for vaginal discharge. Then option C, brown, anorectal discharge. This is correct. This is a newly added one. D is red, lower abdominal pain. This is wrong. Lower abdominal pain, we are using yellow colored kit. Next question. A 36-year-old female present to the casualty with acute onset dyspnea, chest tightness and feeling of impending doom. She gives a history of seafood intake couple of hours back. On examination, you notice swelling of lips with urticaria. Her BP was 80/50 mmHg, SpO2 70% in room air with pulse rate 46 per minute. On auscultation, you hear bilateral wheeze. What is the next best step in the management? So this is a case of anaphylaxis. For anaphylaxis, the treatment of choice is injection adrenaline or injection epinephrine 0.5 mg IM or subcutaneous in the mid outer thigh. We are giving in a dilution of 1:1000. We are giving in a dilution of 1:1000. So the option is option A. All other options are wrong. Next question. All are true regarding treatment of hemophilia except a primary prophylaxis is defined as maintaining the missing clot factor at level of 1% or higher to prevent bleeds. This option is correct. Factor 8 has a half-life of 8 to 12 hours and requires injection twice a day. Option is correct. DDABP, that is desmopressin, is used for the treatment of severe hemophilia A. This option is wrong. This is only using for the treatment of mild hemophilia. Bleeding in the gum and GIT can be treated with tranexamic acid. This option is also correct. So the answer is option C. This is the wrong option. Next question. Which of the following is not used for the treatment of hepatitis C in India? Okay, next question. Which of the following is not used for the treatment of hepatitis C in India? For the treatment of hepatitis C, we are using RNA polymerase inhibitors like drugs ending with buvir like sofosbuvir, protease inhibitors like drugs ending with previr like symprevir, then direct DNA protein inhibitors, that is drugs ending with asvir like lepidasvir, and all drugs like ribavirin and interferon alpha. So here the drug which is not used drugs are sofosbuvir, ribavirin and velpatasvir. This sofosbuvir is a RNA polymerase inhibitor. Ribavirin is an old drug. Velpatasvir is a direct DNA protein inhibitor. And the drug which is not used is entecavir. So here the answer is option A. Next question. A 24-year-old female was admitted with alleged history of ingestion of 30 tablets of 10 mg amlodipine. Which of the following therapeutic options are ineffective in this patient? Okay, we know that amlodipine is a calcium channel blocker. So there will be hypocalcemia. So we can use this IV calcium gluconate, IV glucagon and high dose insulin. And the therapeutic option which is ineffective is hemodialysis. Okay, so this is a correct option. Next. Choose the correct option based on the statement below. So this is a question on anti-snake venom. First option is ASV available in India is polyvalent freeze-dried with shelf life of 5 years. This option is correct. Dose of ASV in pregnancy is same as for the non-pregnant adults. Correct. In case of drug allergy, ASV test dose should be administered. This is wrong. Purely local swelling, even if accompanied by a bite mark, is not a ground for administering ASV. This is correct. So the option D is correct. Only 1, 2 and 4 is correct. Next. All the drugs have mortality benefit and reduce further heart failure hospitalization in heart failure reduced ejection fraction except. So the drugs that have mortality benefit and that reduces heart failure are first one is ARNI like sacubitril and valsartan. Then SGLT2 inhibitors like dapagliflozin. Then AC inhibitors or ARBs. Then aldosterone receptor antagonists like spironolactone. This digoxin option D that do not have a mortality benefit. So the option D is the correct answer. Thank you.